Hi, this is Dr. Lauren Allison again, and in this video I want to explain the difference between naprapathy and chiropractic. So a lot of people have obviously heard of chiropractic. Not as many people have heard of naprapaths because in my home state, Illinois, there's only about 200 practicing naprapaths by license. Now, the difference between these two treatment protocols is that chiropractic is more about adjusting for bones, right? So they get the tissue in a certain place and you get it just in the right place and then you move it kind of quickly, and that is to kind of force the bone into the correct position. Now, that is a generalization. There's a little more to it for understanding from a practical standpoint as to what you're doing it, how you're doing it, and why you're doing it. A naprapathy, on the other hand, is a connective tissue, which I had explained in the what is naprapathy video. Connective tissue treatment. And so let's say that there's a spinal issue and someone has some problem with their low back or their mid back or their neck. And so from a naprapathy's perspective, you want to find the connective tissue that is pulling the bone, and you're working that connective tissue so that you are getting the connective tissue straightened out, so that's ligament, tendon, muscle, so that the bone can either move on its own or be kind of nudged into place, for lack of a better way of putting it. It is not high velocity adjustment, and in some chiropractic they use what are called high velocity adjustments, where they take the musculature to a certain point and then they kind of move it real quick, move the bone or the joint kind of quickly to try to get the bone to sit correctly. Now in naprapathy, we don't treat with high velocity adjustments. It's treating the connective tissue and then either nudging or slowly moving that joint into place to see if it will sit after you've worked out the connective tissue issue there. Now, for the most part, that is the difference between naprapathy and chiropractic. So if we're talking about a treatment protocol, a lot of people wonder, well, I don't understand, what's the difference? Because I've been to a chiropractor, so what does a naprapath do? And it's basically that. It's essentially what is a non-force technique, so that once you've worked out the connective tissue, you can kind of gently move that joint to the proper position. So that's the general difference. Now there's a lot of other nuances with the way a naprapath's philosophy may be and a chiropractic philosophy. Although very similar, treatment protocols are definitely not the same. So hopefully that helps. If you have questions about the difference or what you can expect from a naprapathic treatment, please, you can call, you can email us, and we'll be happy to give you any more clarity that we can. So thanks for watching, and we'll see you in the next video.